In today's video, I want to explain in simple language the main blood tests we ask for when following up patients with rheumatoid arthritis. Many patients get worried when they see numbers that are a bit high or a bit low, even when these changes don't mean anything serious. So let's go together through the blood tests, what they mean, and how doctors actually interpret them in real life. I'm Dr. Hatem Eleishi, Professor of Rheumatology in Cairo, Egypt. Let's begin. We start with the inflammation markers, the ESR, sedimentation rate, and the CRP, C-reactive protein test. If the figures are elevated, this means there is some inflammation somewhere in the body. If there's no other reason for the inflammation, then we usually assume that the high ESR and the high CRP are coming from rheumatoid joint inflammation. And when the numbers go down, it often means the joints have less inflammation. The ESR is a slower test and is affected by many factors like age, anemia, infections, and even some medical conditions. CRP is faster and more accurate for inflammation. Ideally, we either have more pain and more joint swelling and high ESR and CRP indicating active disease, or less pain and less joint swelling and less normal ESR and less or normal ESR and CRP indicating quiet disease or a remission state of the disease. But in real life, it's not always that straightforward. You may have clear symptoms of active RA with pain and swelling, but the ESR and the CRP stay normal or slightly elevated. It happens sometimes. Or you may feel a lot of pain, but on examination, the joints are not inflamed and the ESR and the CRP don't really change. In these cases, we consider other causes of pain that are non-inflammatory, like fibromyalgia that causes pain with no inflammation, or low vitamin D or thyroid problems. The opposite scenario can also happen. You feel quite okay, but the ESR and the CRP are high. In that situation, we always look first for other causes of inflammation like a throat infection, a tooth infection, a urinary tract infection, or a skin abscess, for example. When lab results do not match the symptoms and the physical examination, we doctors need to interpret them carefully. We explain the results to you so that you understand what is happening, but this does not mean patients should adjust medications on their own. This is dangerous. The summary of this point of the ESR and the CRP: the ESR and the CRP are helpful, but they tell you only part of the story. A normal ESR or CRP does not mean you don't have RA, and high numbers do not always mean the disease is flaring or out of control. Investigation number 2, the CBC, complete blood count. This test will look at hemoglobin, white blood cell count, and platelet count. Low hemoglobin means anemia, and anemia in RA can happen because of the disease activity itself or because of small repeated bleeding from the stomach or intestine due to using a type or family of painkiller medications called NSAIDs. It can also come from another condition that coexists alongside RA. Watch my video about anemia in RA for more details. It's on YouTube also. Doctors sort out the cause by looking at the details of the blood picture and by reviewing medical history, your medications, and any other illness you suffer from. We also look at white blood cells because some RA medications can lower them. If the white blood cell count is low, we may repeat the test in 10 to 15 days, reduce the dose of a medication, or stop it temporarily depending on how low the count is and how fast it is dropping. Sometimes white blood cells go up if there's an infection somewhere in the body, and in that case we confirm and treat the infection and often reduce some immunosuppressive medications till the infection is over. Platelets may rise when inflammation is strong. They can reach 500,000 or more without being dangerous, as long as the CRP and other markers of inflammation are also high. Low platelets can happen with certain medications, but this is uncommon. The third important investigation is the liver enzymes, ALT and AST. Many RA medications can mildly increase these enzymes. Most of the time, the elevation is small and goes down on its own. We may repeat the test, reduce the dose, or pause a medication for a short time. We often prescribe a liver supplement for a couple of weeks to help the numbers settle. This is usually not serious at all unless the enzymes stay very high for a long period of time without anyone monitoring them. This is rare, of course, and should never ever happen if follow-up is regular. The last investigation is the kidney function. mainly the creatinine level. This is not something we need to check at every visit unless a patient already has kidney problems from another cause like long-standing diabetes or high blood pressure or is at risk. RA itself rarely harms the kidney, and most RA medications do not affect kidney function. The only common medication that can affect the kidneys are the NSAIDs family of painkillers. And if they harm, they will harm a kidney that is already weak or impaired in its function from the start. They never harm a normal kidney. A normal kidney will generally tolerate the NSAIDs when they are used correctly under medical supervision. That was the main list of the follow-up labs we request to follow up patients with rheumatoid arthritis. At this point, you might wonder, where is the rheumatoid factor and where is the anti-CCP test? Those two tests are not usually for follow-up. They are used only at the diagnosis stage to help identify patients who have positive antibodies and those who have negative antibodies. This helps only predict which patients are more likely to have more aggressive disease, at least at a theoretical level. Rheumatoid factor and anti-CCP are not helpful for monitoring disease activity. Nevertheless, many patients are obsessed with repeating them in every visit, believing that they are the gold standard in telling if their condition is improving or not. This is not true. These antibodies usually remain positive for life, and the levels will go up and down regardless of whether RA is active or is in remission. So please don't repeat them unless your doctor specifically asks for them, because they do not help in follow-up. How often should we do the blood test for follow-up? The CBC and liver enzymes are usually checked every 4 to 8 weeks, and sometimes less often if the patient is very stable on the same medication. Kidney function can be checked every few months. ESR and CRP are done when your symptoms or your clinical picture suggest an ongoing inflammation. Now, a very important point: what labs cannot tell you? Lab tests cannot tell you how much pain you feel, whether your pain is from inflammation or something else, whether a joint is starting to erode, or whether you need to increase or decrease your medications. These decisions come from a full clinical assessment that includes your symptoms, your joint examination, ultrasound or MRI if needed, and the trend of the ESR and CRP and your response to medications. Only when we put all these elements together do we know your actual disease activity and what needs to be done. So to sum up, understanding your lab tests will reduce your anxiety and help you feel more confident in your treatment plan. Your lab results tell part of the story, but you and your symptoms and your progress tell the full story. I'm Dr. Hatem Eleishi, consultant rheumatologist. If you'd like a PDF summary of this video, just send a WhatsApp message to 002010 100 98868 with the words RA Labs Summary, and my team will send it to you. If you'd like to watch this video in the Arabic language on my Arabic channel, I will leave the link to the video in the description below. And don't forget to subscribe for more clear science-based guidance about rheumatoid arthritis. See you in the next video.